Okay, I'm going to start out my comprehensive exam by listing the first 5 and explaining them. So first would be to complete the concept of hand hygiene by washing my hands. I can also use hand sanitizer for this. Second would be identifying my patient by asking for a full name and date of birth. I can also ask my patient if he or she has any allergies. I can pull the curtain to protect the patient's privacy. And last, I can educate the patient on the reason for today's visit. So I'm going to start off by first asking my patients a few questions. Can you please state your name?
Carol Sylvester.
Where are you?
I'm at home in my kitchen.
Why are you here?
Because I am your patient today.
And what is the current date and time?
December 3rd, 2020, 8:58 a.m.
Okay, now I'm going to have the patient perform heel-to-toe walking, but first I'm going to demonstrate what that would look like. So I'm going to move the camera down. I'm going to have the patient start over here and just go like this, walk up towards the camera. Okay, very good. The patient is well balanced. I'm going to ask her to move back to where she started from and to walk towards the camera, walking with eyes closed towards the camera. Her eyes are closed. I'm just going to move the camera up so you can see that. Okay. Next, I'm going to perform the Romberg test on the patient. I'm going to ask her to face this way. I'm going to ask her to stand here for a few moments comfortably, and I'm going to feel her back for any signs of swaying. Okay, I don't feel any swaying, so that would indicate a negative Romberg. Next, I'm going to ask the patient to face me and stick her arms straight out in front of her like this. As the patient sticks her arms out, I'm going to press down, watch as they recoil, which is what they should do. That's what we want to see. So next, we are going to move on to the muscle tone portion. So first, I'm going to start by feeling the patient's deltoid, biceps and triceps, quadriceps and hamstrings, but I have to move the camera down. Okay, everything feels good. Nothing should feel loose, and there should be no swelling or anything for the muscles. Next, I'm going to move on to the test for pronation versus supination. So I'm going to ask the patient to place her hands down on her lap like this, and then she's going to rapidly flip back and forth. Okay, that looks good. The next test that goes along with this is the test for muscle strength. So I'm going to ask the patient to first I'm going to place my palms out and ask her to press down as hard as she can. Okay, that's a test against resistance. So next I'm going to ask the patient, I'm going to cross my arms like this, I'm going to cross my fingers like this, and I'm going to ask her to squeeze my crossed fingers as hard as she can. Very good. And then the final test is the hand grasp test. It's kind of like a handshake except without the shake, so I'm going to ask the patient to grasp my hand firmly. Okay, that looks good. Next I'm going to move on to opposition. So opposition would just be the finger to thumb test. The patient has to touch each one of her fingers to her thumb. She could do that a couple times with the eyes open and a couple times with the eyes closed. Okay, next is going to be the finger to nose test. I'm going to hold my arm out like this in front of the patient with my index finger pointing towards her nose. She's going to grab onto my wrist, and she's going to touch each one of my fingers to her nose besides my thumb. Okay, that looks good. Next is the fingers to nose test with the patient's own nose. It's going to look something like this. I'm going to ask the patient to do this exercise a few times with the eyes open, and then a few times with the eyes closed. I'm going to move out of the way so the patient has room. Okay, that looks good. I'm going to ask the patient to please sit in the chair so I can begin assessing the head and neck. When looking at the head, I'm just going to be looking at the head first for size and symmetry. Then I'm going to take a look at the scalp for any lesions, any signs of infestation, check out the patient's hygiene, the texture of their hair, the color of their hair. Everything seems normal. So next I'm going to move on to the patient's neck. I'm going to first assess the neck by looking to see if I see any lesions, which I do not. Move the shirt a little bit. No lesions, so I'm going to Ask the patient to bend their neck first to the one side like this, and then to the other side like that. Okay? That's just to test the mobility of the neck. So next I'm going to ask the patient to lean their head back a tiny bit. Going to assess the patient's midline trachea by running my fingers down. Everything looks good there. So we are going to move on to the patient's eyes. I'm going to ask the patient to pull down the lower eyelid so I can look in. And open your eyes, looking in at the conjunctiva. Whenever she pulls that down, I should see a light pink to reddish color, so that looks good. I also want to focus in on the cornea of the eye and assessing the cornea for clarity. I'm also assessing the iris, which is the colored part of the eye. In this case, hers is brown. I want to take a look at the white part of the eye, the sclera, make sure that there's no redness, no signs of irritation, nothing like that, and the patient looks good there. So next I'm going to do a test against pupillary resistance to light and pupil dilation. So I'm going to shine my pen light in the patient's pupil and watch as it dilates. Okay, so the patient's pupil is dilated correctly, so that looks good. Everything looks good with the inside of the eye. So next I'm going to ask the patient to blink for me. Okay. After that, I'm going to ask the patient to close their eyes so I can take a look at their eyelids. I'm looking at the eyelids. I'm just assessing for any signs of swelling, redness, irritation, edema, which I don't see, so the patient's eyelids look great. I'm going to take a look at her eyebrows. When looking at the eyebrows, I should be assessing for symmetry. The eyebrows of the patient are symmetrical and even, so everything looks good there. Next, I'm going to take a look at the patient's ears. Before I look in the ears, I'm going to start out with the whisper test. I'm going to stand an arm's length away from my patient. I'm going to say a word, and she should be able to repeat the word or phrase back to me.
Cell phone.
Okay, she got the word correct. So next I'm going to take a look in the patient's ears. First, before I shine my light, I just want to check out both of the ears on each side, make sure they're both symmetrical and aligned evenly, which they are. Next I'm going to shine my light in the ear. Looking in the ear, I'm looking for any signs of drainage, any irritation, swelling, also checking for irritation and swelling on the outside of the ear as well. The patient's ears look great, so next I'm going to take a look at the patient's nose. I want the patient to look at me straight on so I can assess the symmetry of the nose. The nose looks symmetrical, so I'm going to ask the patient to tilt her head back like that so I can check inside. When looking inside the nose, I'm just looking for any signs of redness, checking out the patency of the nose, and also assessing for nose inflammation or nosebleed, which I do not see any of that. So the patient's nose looks great. Finally, I'm going to finish off by assessing the patient's mouth. I'm going to ask if she opens her mouth so I can shine my light. I'm looking inside the patient's mouth with the light. I'm looking back into the throat and at the uvula. I'm assessing for moisture, color, also checking out the tongue, checking out the midline of the tongue, also making sure there's no fissures on the tongue, which I do not see. Taking a look at the patient's teeth, I want to assess for size and condition. The teeth look great, so moving on to the mucous membrane. That's like in the buccal area of the mouth, kind of on the inside of the cheek, looking in there. Everything looks great, just checking for moisture, color, looks great. Alright, so now that we've finished with the mouth, we're going to move on to the musculoskeletal portion of today's exam. I'm going to ask the patient to please stand up, take a walk that way, and turn around for me. Alright, I'm going to ask the patient to sit down. And before I move on to the musculoskeletal portion of today's exam, I'm going to ask the patient to allow me to feel the two sinuses on her face. The first one is the maxillary sinus, so I just assess that by lightly pressing down on the maxillary region, and also the frontal sinus, which is kind of in between the eyebrows, and where I would do the same thing, just lightly press down. Applying gentle pressure. And now I will move on to the musculoskeletal portion of the exam by asking the patient to take a walk that way and please turn around. When assessing the sinuses, I would also want to make sure for any signs of facial drooping, which I do not see on the patient, so she looks good. The purpose of having the patient take a walk like she just did and turn around was so that I can inspect her gait. So now that I see that her gait is well, I'm going to take a look at the patient's back, so I'm going to have her turn around the other way. I'm going to take a look at the patient's back and just assessing for curvature. I'm going to have them turn this way so you can see. I'm going to have her bend over. I'm assessing the back for curvature, any signs of scoliosis or any other kind of bad condition like scoliosis, which I do not see. So next I'm going to ask the patient to turn around and face me. I'm going to take a look at her skin. checking out the condition, the color, and just as overall assessing the skin for the following joints that I'm about to test the range of motion on. So I don't see anything by just looking, so I'm going to begin on to the range of motion test. So first is going to be flexion of the head, in which I would ask the patient to just put their head down in the flexion position, head down. Next, I would ask the patient to put their head back in a neutral, normal position. So this is demonstrating extension. Next is hyperextension, which is when we have the neck back. Next is the chin to each shoulder to show lateral rotation. So I'm going to ask the patient to put their chin to each shoulder. Okay. Next is going to be the ear to each shoulder to show lateral flexion. Just ear to each shoulder. Okay. And then I'm going to have the patient rotate their head to either the left or the right, whichever side they choose. I'm going to test their strength against resistance by pushing the opposite way. Okay, now she can try it on the other side. I'm going to do the same thing I just did. Okay, everything looks good there. So we're going to next move on to the shoulder by first showing shoulder flexion. Shoulder extension, just be flat, arms by the side like this. Hyperextension is going to be back. Abduction and adduction, just be out and then back. Circumduction is a big circle with both arms. Internal and external rotation, both arms. Okay, now I'm going to have the patient shrug their shoulders, both shoulders, and each one when she shrugs, I'm going to test her strength against resistance, so shrug, okay? Very good. Next, I'm going to move on to the elbow. First, I'm going to show flexion like this. Elbow extension would just be straight out. And then for the flexion, I'm going to have her do that one more time so I can test her strength against resistance. I'm going to push back. Okay, very good. I'm going to show pronation and supination now, kind of how I did in the beginning, but this time when I show it, I'm going to have the patient, like instead of putting flat, I'm going to have it do her with bent elbows like this. So I can have the patient do that. Okay, next is the wrist. So for flexion of the wrist, it would just be like this. Extension. And then hyperextension would be as far back as the patient can go with her wrist. There she goes, very good. Radial and ulnar deviation. For that is just going to be the palms are going to be facing upward, and the patient is going to rotate their hands like this, back and forth a couple times. Okay, this shows abduction and adduction. So next I'm going to do the hand grasp test. I already did that in the beginning, but it's just to test the patient's hand grasp. She's going to pretend she's shaking my hand. Okay, very good. Next is the fingers and the thumb. So first for the flexion of the fingers and thumb, I'm going to go like this. Then extension would be just flat. Hyperextension, it's kind of hard, but it's just putting your hand as far back as you can. The finger to thumb test, I'm going to do that like I did in the beginning. So I'm just going to have the patient touch each finger to her thumb a couple times. Okay, and then abduction and adduction is just fingers out and then fingers back together. Okay, next we're going to move on to the hip. So first for the hip is going to be flexion. I have to move this down so you can see our legs. So the hip flexion would just be out like that. Extension is just normal, standing up. Hyperextension is back this way, like this. So I can have her do that for you. Okay, very good. Abduction and adduction, so it's just out and then back. Okay, very good. Internal and external rotation. Going internally and externally with both legs. Okay, and then I'm going to have her get in the abduction position again, which is out, and I'm going to test her strength against resistance by trying to push down. Okay, very good. Next, we are going to move on to the patient's knee. So for this one, probably easier to have her sit in the chair. So the first one is going to be flexion of the knee, which is just out like this. Extension is just straight out, like she's laying down flat. Okay, very good. Next, for the knee, I'm going to have her get back in the flexion position, which she just was. I'm going to test her strength against resistance by pushing down. Okay, very good. Next, I'm going to move on to the ankle with plantar flexion and dorsiflexion. For that, it's going to look something like this. You can have the patient do that a few times. And then whenever she does dorsiflexion, which is the up position, I'm going to press down with my hand to test her strength against resistance, and she didn't move, so that's great. Now we're going to move on to the foot with inversion and eversion. I have to lower the camera, ask the patient to please stand up, and I'm just going to put the soles of my feet inward and outward, smooth them. Okay, that looks good. Next, we're going to do the toes. So flexion and an extension of the toes. I'm going to ask the patient to sit down. Okay, so for flexion, it would just be like that, flexion and extension. Okay, very good. Then abduction and adduction. So she's going to spread the toes and put the toes back together, spread together. Okay, that looks good. Now we're going to check out the patient's spine. So I'm going to ask her to stand up and face towards that way. So let's move this. So taking a look at the patient's spine, I'm going to first just have her lean forward. This is the flexion position. Then she's going to stand up straight and tall, neutral position, that's the extension. Hyperextension is when she leans back. That's good. Then the lateral flexion for each side, she's going to move to one side, move to the other side. And then this is, for the lateral flexion is where I would also test the strength against resistance, so she's going to move to one side. I'm going to try to push her to the other side, she's not going to move. Okay, I can do that again on the, test the other side. Okay, great. And then finally for the spine, it'd just be circumduction, which is just in a circle. Okay, that looks good. I'm going to ask the patient to sit down. I'm going to begin to inspect the lungs and thorax. That concludes the musculoskeletal portion. So I'm just going to start by assessing the shape of the chest. I'm going to assess the skin for color, symmetry, tenderness, masses, all of that. So I'm just going to feel. Do you feel any pain in the chest area?
No.
Okay. She doesn't feel any pain, so next I'm going to ask her to make a little heart shape like this with her fingers. I'm going to assess her fingers for any clubbing at the fingernail area, which I don't see any, so that's good. Next, I'm going to move on to count the patient's respirations. So I'm going to time my watch 30 seconds. I'm just going to wait a couple seconds till the clock gets to an even number, and I'm going to count her respirations for a duration of 30 seconds. Start. Okay, stop. So I got 10 breaths for the patient's respiration, so that's pretty normal considering the average range for an adult is between 12 and 20 breaths per minute. If I wanted to find her breaths per minute, all I'd have to do is 10 times 2, so that'd be 20. So her respirations are actually normal. So after that, we are going to move on to assessing the patient for posture. When assessing for posture, I just want the patient to stand up straight and tall, make sure her posture is normal and erect. I don't want to see any signs of distress in the patient, no nasal flaring, no nothing of that. I want my patient to be comfortable. And next I'm going to listen to the lung sounds. Every time I stick my stethoscope down, I'm going to ask the patient takes a deep breath. I'm going to start in the tracheal region, which is at the bottom portion of the neck, and I'm going to work my way around to the patient's back, and I'm going to have her flip around so you can watch the back as well. Okay, she's going to flip around into the camera so I can get her back. Okay, last one. This is the lower spine area. Okay, sounds good. So I was able to hear her lung sounds. Whenever I'm listening, I want to just make sure there's no crackles, no signs of wheezing, no abnormal sounds, which I heard none of that, so that's good. Next, I'm going to move on to assess the neck and blood vessels. I'm going to start by first palpating the left sternum area, just feeling for any tenderness, any masses, and next I'm going to auscultate or listen to the epical rhythm of the patient. Usually you do this with the shirt up, but not for the video. We're not going to pull the shirt up. We're just going to listen to the heart sounds of S1 and S2, and I'll show you about where I put the stethoscope, which is about right here. And I'm just going to listen to S1 and S2 on the patient. Okay, I was able to hear some sounds, so next I'm going to assess the carotid artery on the patient. When I'm feeling this, I'm going to be just assessing for strength and symmetry, and then second I'm going to inspect the jugular vein for any signs of distension, so the carotid artery located about right here. Okay. Strength and symmetry, everything looks good, and then the jugular vein, any signs of distension? Nope, the patient looks great. So next I'm going to move on to the peripheral portion of today's exam. I'm going to start by the inspection of the arms and legs. So when I look at the arms and legs, I just want to look at a few things such as clubbing on the fingernails. I want to take a look at range of motion, color, texture, temperature, arm hair. I want to check out the patient's capillary refill, to do the Turgor test. So I'm going to do all that now, first by asking the patient to move her arm up and down a couple times, just to check for range of motion, which that looks good. Taking a look at color, texture, temperature, arm hair, everything looks good there. I'm going to flip over, no signs of lesions. Taking a look at the patient's fingernails again, as I did earlier, just checking for clubbing, which I see no signs of, so that is good. I'm going to check the patient's capillary refill by pressing down and watching as the color reappears as it did, which that is correct. I'm going to pinch the patient's skin for turgor and see if it goes down back to normal quick, which it does. So that's good. No signs of lesions, so everything is good with the patient's arm. Next, I'm going to basically do the same thing, but to the patient's leg. So I'm going to move the camera down, and I'm going to ask the patient to just bend her leg a couple times so I can check for range of motion. Okay. Everything looks good, so I'm just doing the same test I did before, basically just checking for color, texture, temperature, leg hair. I can do the same Turgor test I did down here just by pinching and letting go, watching as it goes back down. Color, texture, temperature looks good, no lesions. The leg hair looks normal. I can also do the capillary refill test, which I did on the finger. I can also do that on the patient's toe, as long as they're not wearing toenail polish, but I'm not going to do that. You just, well, I can. You just press down on the toenail, let back up, and watch as the color reappears. So everything looks normal there. So next I'm going to talk about the patient's pulses. I'm going to point out and rate several different pulses on the patient, and I'm going to feel one pulse, which is the most common, or the radial pulse located on the wrist. That's the only one I'm going to count. The other ones I'm just going to locate and rate. So the first one, temporal pulse located on the side of the face right here. I'd give this one for, I'm rating them on strength bilaterally, so I'd give this one a rating of 2. Next is the carotid located like on the side of the neck. This one's pretty strong. I can feel it beating, so I'd give this one probably a 4 for strength bilaterally. Next is the apical pulse that's located in the chest area. So this one kind of hard to feel, especially with the shirt on. So I would probably rate this one for strength a 2. Okay. Next, moving on, is the radial pulse, or the one I'm going to measure. I'm going to measure it at the very end, but now I'm just going to show you how I locate it. So I would probably rate this one a 4. This one's probably the easiest to find. It's pretty strong, no closer covering it, so give that one a 4. Next, I'm going to show you the femoral pulse, which is, well, I have to move the camera, but it's basically in between the patient's legs. So it's located about right here. Again, with clothes on, sometimes can be hard to find. For strength bilaterally, I'd probably rate this pulse a 2. So next I'm going to move on to the popliteal. That one is located pretty much at the back of the knee. This one I actually can find pretty good because she's wearing shorts. So I'd probably rate this pulse a 3 for strength. And then there's 2 more, both are at the foot area. So for the first one, it's the posterior tibial pulse. It's like at the back of the ankle, kind of. I'd probably rate this pulse a 2 for strength. And then the last pulse is pretty hard to find sometimes, I think. It's the dorsalis pedis pulse. It's located at the arch of the foot. So rating it on strength, I'd probably give this one a 2 as well. So next I'm going to count the patient's pulse, the radial pulse, for 30 seconds. If it's regular, I'm able to multiply by 2 to find the patient's patient's pulse would be for a minute. If it's irregular, I'm going to want to count for a full minute. So I'm going to start counting first, start at 30 seconds, and I'll decide if it's regular or irregular and give you the number. Okay, I got 37 for the patient's radial pulse, so that's normal. The pulse is regular, so all I'd have to do is multiply the 37 by 2, which would be about 74, I believe. 74 for the what it would be for a minute, so that's good. Next, I'm going to take a look at the patient's abdomen. First, I'm just going to look at it and inspect it for size and symmetry. I'm also going to, if this were real, I would ask her to lift her shirt up so I can let you guys know if the umbilical region is inverted or everted. Next, I'm just going to palpate it, taking a look, making sure there's no bulges, masses, tenderness, none of that. I can also do a strength against resistance test, which she would stick her stomach out like as far as she could. I try to push it back in. Okay, she did good there. So next, I'm going to take a listen to the patient's bowel sounds in 4 different spots. Okay, I was able to hear some bowel movements, mostly in this area. Lastly, I would want to inspect the patient's urine. When I'm inspecting the urine, I just want to take a look at color, amount, any unusual odor. If it's cloudy or clear, would want to see clear over cloudy, definitely. Next, I'm going to take a look at the patient's emesis. I want to check amount. I want to check if there's any blood. Also, blood, if there's any blood in the urine. I want to check color and odor for the emesis. And finally, I would want to check the stool. I would just want to make sure the stool is not cloudy. Not cloudy. Make the stools not runny. I want to see if it's hard or soft. I want to see the amount, if there's any blood, the color and consistency. And finally, I would support the concept of hand hygiene by washing my hands. I would support the patient's safety in all that I do, and I would document everything I just did in the patient's records.